Hi, my name is Mel Barsky. I'm the Director of Business Development at the Centre for Aging and Brain Health Innovation, located in Toronto at Baycrest Health Sciences. I'm excited to be invited here today to speak at EngAGE 21 on the topic of technology and the future, especially as it relates to our aging adults and populations, and to talk about some age tech solutions. I'm going to start off with the need for why we need innovation in this space. One of the greatest reasons is just due to the cost. As Canada's aged population increases, so too does the prevalence of age-related brain disorders, such as Alzheimer's disease, the principal cause of dementia in older adults. As a recent Senate report notes, over 700,000 Canadians currently live with dementia, and that number is expected to climb to 1.4 million by 2031. Costs for the direct care of Canadian dementia patients has been estimated at $10 billion, and that's before COVID. It's even higher now. The combined direct and indirect costs already exceed $30 billion. And of course, the costs to individuals and their caregivers living with dementia are immeasurable. Canada will very soon join those super aged societies by the year 2035. I'm just going to blow this up a little bit so you can see it better. Those in black are those companies that will be having the oldest societies on Earth. Japan is well known today as one of those countries that has a very aged population, and we'll be joining those, such as many of the countries in Europe. And China, which today has over 200 million people living over the age of 65, in 20 years from now, that number will increase to over 500 million people. And you can imagine with the many years of having a one-child policy, how few caregivers there's going to be to take care for that population as they enter their senior years. US and globally, in the US, there's at least 6 million people over the age of 65 living with Alzheimer's or mild cognitive impairment. By the year 2050, that's expected to be 15 million people over the age of 65 living with dementia. Today, care costs are well over $290 billion per year, and by 2050, those care costs are expected to rise to over $1.1 trillion per year. Globally, today, there's over 50 million people living with dementia. That's expected to more than triple by the year 2060. So that brings us to what we do at the Centre for Aging and Brain Health Innovation, and what we're trying to do to solve those issues. Our mission is to accelerate the development and validation and commercialization of those great products and solutions and get them into the hands of those who need them. Our vision is a world in which people can age in the setting of their choice, maintaining their cognitive, emotional, and physical well-being, as well as their independence, as long as possible. I'd like to talk just a little bit about what we do. I'll blow this slide up too. At CABHI, we have what we call an innovation pipeline. We help technologies, innovators, to create those kinds of innovations and technologies from very early stage frontline clinicians, etc., who have an idea and want to create a proof of concept, right through to helping solutions that have a product to help them validate it in a scientific manner in a real world setting. And then we help to take those best solutions and mobilize them and help them to scale and grow and get adoption and into those users' hands. We do this by working with a number of partners from around the world. Globally, we have over 120 test site locations across North America, and partners including partnering with groups like out of Israel, the Israel Innovation Authority, in the UK, UKRI, Research and Innovation, etc., and groups out of Japan, such as Sampo Digital Labs. I'm going to move myself into the top right corner here so I can get out of the way of the stats. So far to date, we have funded over $117 million worth of projects in the longevity space. Some of those projects are very early stage, and some of them very much have gotten to market already. We have, on top of the money that we have funded for projects, we have levered over another $52 million from partners who have helped us to bring these solutions to market. We have funded over 300 projects to date, and as a matter of fact, today we have a pitch competition going on to fund some more. The themes around the projects that we look at are aging in place. More commonly, people are changing that vernacular to aging at home, to caregiver support, care coordination and navigation, cognitive health, and Indigenous, diverse, and rural populations. And most recently, in fact, just this week, we've spoke with our board about adding another theme really around financial health and wellness, which is also a very important area of focus for aging adults. What we do and how we do it, we really help take that those early stage projects, help with the knowledge translation, the validation of those programs, and turn that research into practice and help them get to market and scale and grow. I mentioned at the beginning that we're based out of Baycrest Health Sciences. Baycrest is a 102-year-old institution in Toronto, specialists in geriatric care. They have hospital, long-term care, independent living, etc., plus day programs, and service not only the community in Toronto, but we have global solutions, etc., and online solutions growing now to service a population internationally. We're a global leader in geriatric care, residential living, healthcare, research, and innovation. We have on campus with us the Rotman Research Institute, affiliated with the University of Toronto for over the past 30 years. And our partners include public and private organizations from around the world. I mentioned before, Sample Digital Labs out of Japan, Aging 2.0 is a network, Israel Innovation Authority in Israel, and as locals to those of you in Saskatchewan will be familiar with, the Saskatchewan Health Research Foundation, who we've co-funded a number of programs with in Saskatchewan. Globally, we work with distribution channel providers such as a direct supply, solutions accelerators such as Berkeley Skydeck out of Silicon Valley, and major organizations, companies such as Quanta Computers out of Taiwan. Now to sort of get into the guts, I'd really like to do a little bit of show and tell and showcase some of the exciting solutions that we have funded and are testing at CABHI. First program I'd like to talk about is a company called Intuition Robotics. This is actually a company based out of Israel. Their product is called LEQ. Maybe instead of me talking about the program, I'm going to show a very short video to talk about this exciting robot that helps prevent social isolation by proactively engaging older adults by learning their routines and behaviors and engaging them.
Welcome back. You have a message from John. Would you like to see it?
Sure.
John said, "Hi Mom. Guess where we are today? There's also an image. It looks like they're having a good time in Venice. Would you like to reply?"
Absolutely.
Welcome back. You have a message from John.
Isn't that an exciting robot? There's a number of exciting areas. Virtual reality is a growing area that's very exciting. There's a number of companies that we work with. Some of these are ones that we formally have funded, other ones that we have not. I'm not going to only mention CABHI companies. But Embodied Labs helps with caregiver tools and supports. Rendeavor is an exciting VR program that helps older adults experience scenes from their past, where they grew up, etc., and all kinds of exciting content for them. Mind VR, another one. The Albert Project is one where a number of older adults can sit in a room together, at least pre-COVID they could, and post-COVID they will, and experience an engaging virtual reality experience. There's another program here, I'm going to blow this up just because the printing is a little bit small, that we're doing in Saskatchewan, where we're studying pain mitigation using virtual reality. This poorly managed pain can contribute to disability, frailty, social isolation, and falls in people living with dementia. However, a caregiver's knowledge of pain management can reduce these risks significantly. This research project aims to assess the effectiveness of virtual reality in educating caregivers on pain and its associated negative outcomes. The research project is being conducted by the Saskatoon Council on Aging and the Saskatchewan Health Authority with support from CABHI and, as I mentioned before, one of our partners, the Saskatchewan Health Research Foundation, known as SHRF, under their Collaborative Innovation Development Grant Program. I'd like to show you another really exciting technology. This is by a company called Bitemia and a product that they have developed. They call it Kyogo, and it's a dermoskeleton. And this is a really exciting apparatus that helps people to walk if they were frail for reasons such as arthritis or Parkinson's or MS, etc. I'm going to show you a very brief video again to show somebody wearing this apparatus and how it helps them to walk and conduct their daily activities.
My name is Jean-Maurice. I've had Parkinson's for 2.5 years. I'm in the early phases of Parkinson's. Parkinson's is made up of diverse problems. It slows down your movements. It takes away your dexterity. It takes away your energy. You can't walk a mile or two. Walking upstairs is the same thing. I can walk up a flight of stairs, catch my breath for a minute or two, take a second or a third flight of stairs, one step at a time. Kyogo makes me feel practically 40 years younger. It eliminates the problems I have getting around with my Parkinson's. I can follow any person at a normal pace. I can walk up 5 flights of stairs without having to stop in the middle or stop at each landing to catch my breath, because the effort required for me when I am not wearing Kyogo is huge.
Here's another program of a group that we've worked with out of Norway. It's called Motiview. It's an exercise bike, and in front, what you can't see in this picture, is that, and actually in the picture you will see Prince William and Kate Middleton went to visit this company in Norway. And it helps people, older people, to gain some exercise, get some physical activity while watching on screen videos, again, of scenes from their youth, from their past. So they don't really remember that they're exercising, but as they're pedaling, they get engaged in a virtual reality kind of experience. Another company is called It's Never Too Late, or IN2L. IN2L brings people together, connecting seniors with what interests and fulfills them by enabling them to share conversations and interactions, learning in a fun environment with each other, their caregivers, and their family members. IN2L hopes to create experiences that focus on individual seniors that foster camaraderie and meaning and a sense of purpose, really, positively impacting each member of the community surrounding them. Sort of blow that up so you can see the screen a little bit better. Another company called Interaxon, their product is called Muse, is a little headset that's really an EEG machine that has 4 leads that can measure brain activity and helps you to meditate, helps you to sleep, and other ways to measure your cognitive brain waves, brain activity, and has an app that helps you that you interact with that supports especially things like meditation and relaxation. I'm going to show you a very short video on this company also.
You exercise to keep your body healthy. Now you can do the same with your mind. Muse, the brain-sensing headband, is an easy-to-use brain fitness tool that helps you reduce stress, improve focus, and increase concentration, all in just 3 minutes a day. Muse guides you through a focused attention exercise, measuring your brain waves the same way a heart rate monitor measures your pulse. Then Muse gives you in-the-moment feedback you can track over time. Build a better brain in as little as 3 minutes a day with Muse, the brain-sensing headband. Muse helps you train your brain so you can do more with your mind and more with your life. Learn more at choosemuse.com.
Little ad from Muse. Another company that's really interesting is called ReadySpec. What this company does is they have a camera, very high resolution camera. They'll take pictures of the back of your retina and look for amyloid deposits on the back of your retina. And as that, they can use that as a measure or proxy to see if you're going to develop dementia years in the future. So they can diagnose if you're going to develop dementia years before symptoms actually appear. Why is that important? Because a number of the pharmaceutical companies today are working on drugs and medications that reduce the effects of the symptoms, and the earlier that they can monitor and tackle those symptoms, the longer you can live with those symptoms being reduced. So this is really an important technology that's something that's easy to do. It's non-invasive. It can be done in an optician's office where you look into a machine, same as you would look into a machine to get your vision measured or to see if you have glaucoma or things like that. Another very interesting company that we've just funded is a company called Braze. And what Braze does is they manufacture wheelchairs, smart wheelchairs, and devices they put onto the wheelchair. You can see right here some cameras, some sensors. So if somebody is a paraplegic or a quadriplegic and they have trouble moving around in their wheelchair without hitting walls or objects in their way, they might not be able to turn or rotate their head to see what's beside them or behind them. The wheelchair gives them feedback and advice and information so that they're not bumping into things, and helps them improve their mobility. Another exciting technology is a company called Curiato. I'm going to blow this up a little bit so you can see it better. No, it's not blowing up for me. But what this is, on this bed, there's a bed sheet that goes over top of any kind of a bed mattress. And the bed sheet has sensors throughout the bed that measure things like heat, pressure, and moisture. So that's what you're seeing with these three measurements here. And what that does is if a patient needs to be rotated, you can see where the pressure points are. And this will help prevent developing pressure ulcers, which is a really important thing to do. Instead of just randomly rotating a person every couple hours, this machine, this sensor, will really tell clinicians and nurses taking care of an individual when they should optimally rotate a person when the pressure is getting too high, or when, if a person is perhaps incontinent or wet, needs to be changed, or whether their sheets are wet and need to be changed, etc. So really interesting technology with Curiato. Another product is by a company called CABHI, and what this is a digital urogynecology platform that helps develop a very personalized orthotic device. They've termed the word a gynorthotic, and that helps women with pelvic floor disorders. So older women. This is something that affects more than 1 in 10 women as they get older will have some sort of a treatment to take care of a pelvic floor disorder. And for 100 years, there's been things like, or more than 100,000 years, there's been pessaries made that are just generic in nature. This, for the first time ever, will use an ultrasound technology and 3D printing to make a very personalized gynorthotic device for an individual. Another project that we've been working on in Saskatchewan is with a researcher, Dr. Carrie Barassa. This CABHI-supported project was developed by Morning Star Lodge, which is, as many of you in Saskatchewan probably know, an Indigenous community-based health research lab located in Regina. It's seeking to help Indigenous seniors with living with a dementia-related illness who may be at risk of increased social isolation if they are not connected to a healthcare system that can address their unique cultural needs. By engaging people living with dementia and their caregivers through traditional art and teaching workshops, participants can also access activities remotely. This feature of the project will support participation from those who are often left out of traditional ceremonies due to immobility or lack of transportation. Participating older adults and caregivers are from the 11 First Nations in southern Saskatchewan, represented by the File Hills Qu'Appelle Tribal Council. And to address the most recent concerns around COVID, we've created some of our own innovation in-house at CABHI. One of the things we have developed early in CABHI is an army of robots, as you see in this picture here. And these robots include things such as an iPad, an iPod, Jabra speakers for ease of hearing for older adults. And what we did is we mobilized this army to go into the long-term care facilities to allow family members to communicate with their loved ones, with their family members, when due to COVID, there were restrictions from them being able to visit their family members in long-term care. So a very interesting technology that we actually just built together, put in-house. It also uses some software such as in Ontario, the OTN, Ontario Telehealth Network, so that physicians could also have telehealth calls with their patients, with the people living in long-term care. We even had digital stethoscopes so that the physicians could remotely listen to a person's heartbeat or other vitals. And the future at CABHI, one of the things we're working on is a new program called LEAP. It originally started as an acronym standing for Lived Experience Advisory Panel, and it was really driven out of our own Seniors Advisory Panel that we've had at CABHI for our past 5 years that we've been around. Every innovation that we bring into CABHI, we try to get the voice of the senior included to speak to innovators and let them know what the end user thinks about the technology that they're trying to bring to market. And the voice of the end user, the voice of the senior, is critically important. You can't just develop something in isolation without speaking to them. So what we want to do is create a global version of this program, a digital version, so we can get the voice of our older adults around the world so that we have diversity in terms of geography, in terms of language, culture, etc. And we're just launching this actually at our conference, which also happens to be taking place yesterday and today. But watch for this in the near future. And if you and your communities are interested in joining this LEAP initiative, we would look forward to having you and your communities join. What this virtual community center will do in this platform is we will help with a number of basic functions such as learning opportunities, sharing opportunities of the latest and greatest technologies. You'll be able to try out and be an early adopter of some of these technologies and give feedback and take part in giving feedback to those innovators and large organizations that are looking to enter this. Will likely even reimburse seniors for that knowledge because seniors should be compensated for their role in helping these technologies get developed. There will also just be storytelling rooms and opportunities to share best practices. So that's really my overview of some of the most interesting technologies as we see it here at CABHI. If you'd like to learn more online here, you can see some of our social media and feel free to reach out to me directly in the app. You can see my contact information. And thank you very much for joining me here today. Take care. Bye-bye.